Well, welcome to the HFL 110 Introduction to Healthcare Industry course. For those of you who work in the healthcare industry today, quite a bit of what we're going to discuss is going to be very familiar with you, familiar to you. And when I say familiar, I'm going to say that in the most general of terms because the course is meant to take familiarity and really take you to a deeper level of competency. And for those of you who are coming from outside the industry, looking into it, I think that you're going to find and maybe even be surprised, if not a little overwhelmed, as to the complexities of the healthcare industry. I think you're also going to find that when it comes to our filter that we're going to use, kind of touching more closely to facilities management and engineering, you're going to find that the complexity of what is done in that subset is much deeper than you ever could have imagined. We can almost begin with looking at the word healthcare. The word healthcare, and if you look on the slide here, we notice that healthcare is combined. The word health and care is not separate. This is one of those interesting little issues. It almost embodies what goes on in our industry altogether. Our industry is loaded with all kinds of unique language and all kinds of different acronyms and so on and so forth. And what happens is that it seems that there's, is it potato or is it potato? And we can often get lost in that language. You'll find with healthcare engineering that healthcare and healthcare itself combines the word, whereas many places, many people outside of healthcare, those words are separate. And why is that? I really can't even explain to you other than to say that healthcare is kind of a unique universe that's very much sometimes polarized and dynamic and complex. And it's almost like you have to learn the language of healthcare, which is what I hope to help you do. You notice a little subtext there. It says just when we're beginning to understand. I think that is probably the subtext for anyone that's worked in healthcare for the last 40, 50 years. Just about right when we're beginning to understand something, it changes again. We've seen a major change when it came to the ACA or the Affordable Care Act, often called Obamacare, which is now poised to be kind of changed, if maybe gutted, through the years of the presidential change. What is it going to look like in the future? Great question. You can expect that some things will not be undone. You can expect that some things will be expanded while some things will be changed or shifted. It's hard to say, but just when we're beginning to understand the Affordable Care Act, it's about to take on another transformation. Along the same lines, just when you start beginning to understand accreditation, it's going through a transformation. Healthcare is continually transforming, which is not necessarily a bad thing. We continue to improve healthcare. In fact, this course embodies the changes and the challenges of our industry. And so this course, what we're going to do is we're going to kind of, as I think you'll read, we're going to come at this from like 30,000 feet. We're going to take a step backwards, and we're going to look back in time, and we're going to look through history a little bit, and we're going to look at legislation. And the reason why is because healthcare is the third most heavily regulated industry in the world behind nuclear and airlines. And there's a reason for it. I mean, if you've gone to any of my talks, I'll often speak to this and say that, with obviously with nuclear, when bad things happen, people will die. In airlines, when bad things happen, people die. And of course, in healthcare, unfortunately, it's too common. Bad things happen, and people often do get injured and die. So it's heavily regulated. We're getting better. I think some of it has to do with us acknowledging some of the problems and the issues we have, quantifying those issues, like for example, healthcare infection prevention, healthcare infection issues. So we're starting to quantify things in the last decade, which is really starting to create a lot of shift and change. So, it's a heavily regulated industry. We need to understand regulation. Often that helps us better understand why we do what we do. It often helps us understand why we're going through on a continual transition. After we get through the regulation side, and I want to kind of forewarn you, the beginning is a little heavy. This course is a little front-loaded, and there's a reason for that. I really do want you to question a little bit, not just whether you should be in this course or whether you should pursue this career. I want you to kind of get a sense of the urgency and the pace that happens in our profession. It's not I don't think it's overtly heavy on the front end, but it is definitely going to push you, and you're going to be reading and becoming familiar with quite a bit of information that probably is unfamiliar to you. So we're going to start off by looking at regulation in an industry, and then we're going to start getting a little more structured through the book. We're going to start looking at the healthcare buildings themselves and different types of facilities. And this is really a dynamic conversation with what's happening in our industry, particularly with the outpatient growth. We're trying to, keep wellness out away from the hospital, if you will. We're trying to reduce the cost. It's very expensive to deliver services in an emergency room or deliver services on a hospital. Very expensive. The model we have is to deliver lower acuity, less expensive, more timely, and more convenient services in outpatient facilities. And I think that that model seems to be kind of gelling in these last few years. There has definitely been an explosion in outpatient facilities, which directly impacts our profession and impacts you for the future. I can see many of you working in these outpatient facilities. In fact, I've had conversations with several folks in the program that are taking positions as managers and directors in large outpatient or in outpatient facilities or managing outpatient facilities. So it's becoming a big deal. Even property management for us is becoming a big deal. So, looking at these different buildings, we really need to pay attention. If you came into this class thinking, well, I'm going to work in a hospital, well, I think you need to really open up and say, maybe I'll work in a residential living place. Maybe I'll work in a nursing home. Maybe I'll work in an imaging center, an orthopedic surgical center, or, in a rehabilitation center. It can go on and on and on. There's so many options that are starting to reveal themselves to our profession. So we're going to look at these different facilities. And then we're going to go into the hospital and start looking at departments. We're going to start breaking down the hospital itself into some of the major departments, some of the areas defined by clinical and ancillary areas. We're also, again, before let me go back just a little bit here. We're going to take a look at the for-profit and not-for-profit. We're going to have a conversation about that because that's a pretty dynamic conversation that's going on and will continue to go on in our industry. More hospitals have been sliding over to for-profit hospitals. Fewer hospitals are not-for-profit. And there's a reason for that. And we're going to talk about that, and we're going to research that. It's an important thing because, most of us are used to working in a not-for-profit hospital. Most of us would say we prefer to work in a not-for-profit hospital healthcare system. But the reality is more and more of us will and do work in for-profit hospitals. So we need to understand how different are they, or maybe how different they're not. The other side of this, again, gets in those departments like I talked about, and we're going to start breaking them down. My hope there is that you, again, as we go through this, you're going to sort of pick up the language of healthcare. We're also going to be using a kind of odd way of doing it. We're going to be using what's called the Fdi Guidelines to do this. And the reason why we're using the Fdi Guidelines is because it is a very integral document, and it's actually a compliance or a code document. If some states have adopted as code. And if you live in one of those states, it is a code document. But it's a reference document for construction and design of healthcare. And it gives us a lot of guidelines. And so what we're planning on doing is I actually use this book in multiple classes for multiple reasons, with the whole idea that by the time you get through the HFL program, you're very familiar with this book and you're very comfortable with it. So while we're not going to use it in any great depth, trust me, in other courses we will use it much more deeply. But we're going to use it as kind of, again, as a reference book. We're going to kind of lightly touch through it. In fact, you're going to feel like you didn't get your money's worth, and to some degree, when we finish this course for that book, we one of those classes where we go through, 10% of the book. But that's the intent. Just touch it, get familiar with it, and use it to understand healthcare a little better. And then at the end, our last big module at the end is going to have to do with accreditation. We're going to look at accreditation, which is a major issue for every healthcare organization that receives money from Medicaid, Medicare. If you receive any government funds, you're going to be accredited, and you're going to have an accreditation organization come to your hospital, and they're going to survey you. And there are a half dozen surveying organizations. The largest surveying organization, and most people know the name, is the Joint Commission, TJC. And the Joint Commission really is the one that has the majority of the hospitals around the country. But before the Joint Commission, and sometimes people kind of think the Joint Commission is sort of the beginning. Well, they're actually really, they're employed by CMS or CMMS, Centers for Medicaid Medicare Services. And we really need to understand that, because the Centers for Medicaid and Medicare Services is where accreditation begins. And they have these standards, if you will, called conditions of participation. And we're going to start to understand that. We're going to understand the structure of accreditation, because it helps us better understand how we, again, just like codes and regulation, how do we get here? And just like accreditation, where do these things come from, and how do we get there? And we're also going to look a little bit at some of the problems we have specific to facilities management when it comes to accreditation. So it's going to be a pretty high level conversation or course that we're going to go through. You're going to definitely develop your competency when it comes to understanding some of the language of healthcare and some of the specific things that make up healthcare. And that's the goal for this class. Now, if you're taking HFL 100 partnered with this, you're going to go kind of into the hospital and get a little deeper into all these things. And you're going to start breaking the hospital down even further and really understand how does facilities, how is it constructed inside of the hospital. So this is the class. Again, this first, the beginning, we're going to be, again, looking at accreditation. You're going to be doing some papers. We're going to be introducing ourselves, getting to know each other. And hopefully, by the time we're done and you do your final paper, you're going to look back and realize that we'll come a long way through this course. I'm excited that you're here. I'm excited that no matter what you do as it relates to healthcare, you're going to take away a lot from this course that will benefit you for your professional and your academic future. Well, let's get to it. HFL 110, Introduction to Healthcare Industry. Welcome.